So we're here today with Linda, and Linda agreed to come in for this interview to share her story with us, and she told me that it was okay that I speak to you guys about what we actually did for her. And Linda she had worn dentures for many, many years. What did you say, 30 or 40?
Oh, at least 40 years.
40 years ago.
Early 20s.
Right, and then she had a lower partial that she absolutely hated. It didn't fit her right, and it was uncomfortable for her. And so her treatment was a new full upper denture and a new lower denture. We had to take some teeth out, and we placed a couple of dental implants. And I asked her to share her story about how she was before she had the treatment done and how she is now, and what the treatment was like. So tell us a little bit about how it was for you before I took care of some of your dental needs.
Okay, having had dentures for most of my adult life, I realized that it was time for me to upgrade. My chewing capability was off. That affects your whole health, obviously. So I decided to find a good dentist that would improve and give me a brand new smile.
Yeah.
So that's what I have today, is a brand new smile, and I'm very pleased. It's well worth it. I think your staff and yourself made the transition very helpful for me. It was intimidating at first, but I put my trust in you, and I'm very pleased.
Oh, I appreciate that. So now, you mentioned earlier you had some soreness from your partial. Didn't fit well.
Right. I had some teeth that had been removed since the partial was made, so obviously they weren't fitting right. When you chewed, they were moving. Adhesive was becoming a nuisance. Okay. All the above.
Okay.
And I knew that it was time for me to do these things for my health.
Very good.
You know?
And so, well, what was the procedure like for you? I know there's some steps with the dentures, but if you focus a little bit on, we took the teeth out and placed the dental implants. A lot of people are afraid. They think, I don't want to have something screwed into the bone or my jawbone. But how was it for you?
It wasn't bad at all. You took me through it step by step. It's kind of overwhelming when you hear about all the steps that have to be done, but every step was an adventure. You just take it one step at a time, and you go through it with no problems at all. And it really wasn't. I was a little skeptical at first. I asked for to be put to sleep to have the extraction done, and then after that, you advised me that local was fine, and we went the local route with just Novocaine, and it was fine.
So we didn't sedate you.
The first visit I had with the extraction, we did.
We did sedate you.
And I guess I did okay. I don't know. But after that, I just did the local, and everything was fine. Your team and everything.
Perfect.
Was
perfect. And so your chewing ability now, tell me about.
Much better now. I see a big difference when you don't know that your chewing is off and your bite is off. Now I see a big difference with chewing your food properly, and even tasting your food is better, because you're not struggling to.
Right. And you probably enjoy more of the foods that you like to chew.
Yes.
Yes.
So,
and so how about your smile? What do you
My
think?
smile is beautiful. I've had a lot of compliments. I'm pleased with my smile. I think my smile is great. I'm not intimidated to smile, or I love it.
What's amazing is that when I see patients like you, and I don't mean this in a bad way, but I can see the smile before the smile is there. I really can. I see the patient's face, and I see the beautiful smile there, and that's just a gift that I've been given that I'm able to do. And so, well, thank you so much for sharing your story with us, and I would hope that if you ran into somebody that was interested in a similar situation, you would recommend that.
I would recommend it
Perfect.
highly. It's like I said, it's really not intimidating.
You get through it, right?
You get through it.
Yeah.
You get through it, and at my phase in life, I'm going to be retiring, so I wanted a new smile and a new beginning. And
Time to head to Europe.
And you gave it to me.
Okay, thank you very much.